You're listening to the Erica and McAfee podcast, where we share stories of grief and loss due to miscarriage, infant loss, stillbirth, and journeys of trying to conceive and infertility. Welcome to episode 16 of the Erica and McAfee podcast. October is here, and it is Pregnancy and Infant Loss Awareness Month. Today's podcast is brought to you by MyBabyExisted.com. Go to MyBabyExisted.com to download your free meme, download it, and post pictures to your favorite social platforms, Instagram, Twitter, Facebook, and use the hashtag MyBabyExisted. We remember our angel babies all month long and honor their existence in our hearts and minds. In today's episode, Dr. Shaughanassee Williams shares her experience with Black women's health issues like PCOS, endometriosis, fibroids, and how they affect getting pregnant and subsequent losses. Dr. Williams is an emerging trailblazer looking to establish positive change in her community and around the globe. She is a certified nurse midwife, holding a doctorate of nursing practice from Hampton University, a master's and bachelor's of science in nursing from Old Dominion University, and a nurse midwifery endorsement from Shenandoah University. She has extensive leadership experience working in the healthcare arena as the visionary and director of HealthyHER Center for Women's Care, a nurse midwife at Bon Secours Medical Group, and also an adjunct nursing professor at Norfolk State University. Her passion lies in her leadership development and carrying on the long-standing entrepreneurial spirit of her family. She is also the think tank behind Midwife Speaks, her platform to educate and empower women regarding holistic health. She has been coined the people's choice for women's health. Through transparency and with authenticity, Midwife Speaks is the bridge between patients and providers by giving women and their families the necessary tools to holistically empower their physical, mental, and spiritual health. In this episode, Shaughanassee and I discuss the steps we can take to keep our bodies healthy in order to get pregnant and prevent losses due to women's health issues. Well, thank you, Dr. Williams, for agreeing to be a part of the podcast.
Well, thank you so much for having me. I'm so honored to be here today.
So I like to start the podcast with everyone just telling about themselves. So tell us about yourself and tell us what you do.
Sure. Well, my name is Dr. Shaughanassee Williams. I am a certified nurse midwife, and I have my doctor of nursing practice degree. Basically, I am what I call myself as a servant to women. I am there to assist them in their healthcare needs and help them to meet their healthcare goals, whatever they may be. We often discuss a lot of different things, a lot of different goals that they may have. So I just try to be that person to help them help themselves to be their best self and be their healthiest self. I do work in multiple clinics throughout Hampton Roads, but I'm just happy to do what I do and to be able to help out the ones who I believe God has entrusted into my care.
Awesome. So what is a midwife and how do they differ from a doula?
Sure. Well, people from my experience, when I tell them that I am a midwife, they kind of have this preconceived notion of what midwives are. Part of that's true, and then part of our role has really expanded. I think that many people think the term midwife is archaic, and they haven't seen them in a long time, but there are some excellent midwives out here all over the U.S. and all over the world, actually. So we're bringing it back, making midwifery sexy, so to speak. But as a certified nurse midwife, there are what we call midwives, and then we have certified nurse midwives. So I can speak to the certified nurse midwife part since that's what I'm licensed as. But essentially, we are registered nurses who have obtained an advanced degree. So we've gone back for an additional set of education where we can specialize in women's health care, essentially. And we have become healthcare providers for primary care needs and the reproductive care needs of women. So a lot of what we do does focus around pregnancy, birth, postpartum time frame, and so we focus on mothers. But we also are really much an integral part of taking care of women throughout the whole spectrum of their life. So we work with patients as young as teenagers who are just now, coming into puberty and starting menstrual cycles and things. We work all the way to women that have entered into menopause and are in that opposite, change of life. So I have patients who are all over the spectrum. We focus on gynecology, and just depending on where the midwife is located, you may not have many healthcare providers in that area. Maybe you're shorted. So if there's not a primary care provider, then the midwife may be able to practice some type of primary care need as well, because again, we're all trained as nurses, so we have that knowledge about kind of the whole body system, if you will. So sometimes I've had to manage high blood pressure. Sometimes you have to manage diabetes, and sometimes you have to manage different things in addition to, pregnancy. So I think it's really great to be able to do all of that from, I always say, kind of the womb to the tomb type of care. Right. And so we are different than doulas, but we work really well with doulas, and they are really an essential piece to the care that we provide to mothers during pregnancy, during the labor period, and also during the postpartum period. Doulas they're specialized birth attendants, and they are really kind of, I call them the mothers of the mother. So they really help to be that advocate for the mother and to be that support for the mother, and really to be that advocate and support for the family to have the birth process that they want. So just because a woman has a doula doesn't mean that she's going to have a natural birth, and we may want that or promote that, and that's excellent. Some women don't have that experience, and they still can benefit from the doula. It's that person that's with them to kind of help center them, because if your body is going through this major change, I always say you can't think straight when you're in pain like that. Right. So you need someone who's there for you, and your family sometimes they're in that emotional state with you because you're going through a change together. So that doula is there to kind of center you, to help you focus. They're there to really educate and empower you. They're there to speak for you in times where you cannot speak. They help to guide the labor process. And then the midwife, we would be that primary caregiver to help deliver the baby, help to monitor your health, help to monitor the baby's health in that immediate period, and to provide the hands-on medical care that mom and family would receive.
Awesome. So yeah, that definitely clears up for those who are out there who may be wondering the differences between the two. And, when I think of midwives, I do think of like back in the day when our grandparents and great grandparents, they all had midwives as well that were there with them to help deliver the babies. And, back in slavery days, we going all the way back. Most Black women back then were the main folks who delivered babies, and they were midwives. So I'm happy that you kind of distinguished the differences in how you all both work together to bring forth life. So
exactly, and that's part of what I love too, because we are really into that holistic care. How can we take care of the entire woman? So that's what I love about what we do. Right,
which is awesome, So what are some factors that you've seen in your practice and in your work that are preventing Black women from conceiving?
I would say the ones that I see the most, the top one that I see a lot is obesity. And that's just an epidemic that we have all over. But especially in certain communities, a different attitude towards it than in other. And I don't think, and I'm coming to understand more as I even do more research, the effects that weight has on our conception and how it has it on our fertility, where a lot of, our hormones come from a central place, and fat tissue can really disturb some of that hormonal balance. So we may look at it, well, okay, I got a little extra pounds, or I'm sick, and all those things are good. I'm not skinny mini myself either, but I do try and live a healthy lifestyle, and that's what I try to really encourage my patients to do. And sometimes the obesity factor and the weight factor will cause certain chronic health conditions in women, or it will precipitate and make the conditions they have worse. High blood pressure for some, for example, diabetes, for example. We'll talk often my conversations with women who may have PCOS or other endocrine issues. Weight is a huge part of that a lot of people aren't necessarily aware of. And so it's something very simple, and it's something manageable. And I think simple in that it's just easy to fix. It's something that is within the hands of the patient that you have the power to do something about, and it's very much preventable, and it's something that's reversible for a lot of people. And then if we can really master that, then we can really help women to conceive and have the families that they want to have. So I think that's one of the big ones that I definitely see for all women, but especially for African American women, is just weight management.
So as far as weight management is concerned, do you believe in like the BMI? Do we have to get into our certain height and weight category when it comes to BMI? Or do you feel if you lose and shed, 15, 20 pounds, that'll help increase your chances of, being able to conceive?
Well, I can't say that, CDC has these rules out there and they've been researched, to support it. But I will say, even for women, I understand, that if you are way overweight, or depending on your height and your weight, you may be categorized as obese, and you're like, what in the world? How do I can't be 120, like that's just unreasonable for me. But I tell patients it's not a perfect world out here. The goal is to be healthy for me, and really to just work on it. If we're working towards that goal, then you're steadily making progress all the way. And it's a lifestyle change. So it's not something that you're just going to do, before you get pregnant or whatnot. This is something that you're going to continuously be doing throughout your life. So research even shows for some women just a 10% reduction in their weight will really benefit their health in so many wonderful ways. So if you're 200 pounds, just by losing 20 pounds, that's going to do miraculous things for your body. I've seen people not have menstrual cycles, and just by losing weight, now their bodies are regulated, and that helps the conception cycle. And that's something, again, like I said, is very much in the hands of the patient's control, something that we don't necessarily have to prescribe you a medicine all the time for, but just great lifestyle choices, some accountability. And if we do have to, do some things to help support that from the medical side, then we are all about that. And I also try and help my patients understand, too, that even though we are working maybe for conception, like right now, in the present, we also have to think about what your life is going to be 10, 20 years down the road. How can we prevent chronic disease? So, yes, we want to achieve these goals right now, but I don't want you to be 50, if you're a 30-year-old woman now and have these health issues because we didn't talk about them when you were here in my office today. So we have to think about the present, but we also have to think about our future as well.
Wow. Yeah, I agree completely. So I have a lot of friends who are over 30, closer to 35. We're getting close to that age. They have PCOS, they have endometriosis, they have fibroids. What are your suggestions on things they can do to increase their chances of getting pregnant?
I would encourage people not to give up. You want to make sure, first of all, that you are seeking a healthcare provider that knows you, understands you, and is committed to working with you. I make that personal commitment with my patients where I'm going to try my hardest to help you achieve your goals. And if I cannot, I'm going to make sure that I refer you to someone else who's going to help achieve your goals with you. So I'm not going to give up. I'm not going to let you give up unless you say, hey, this is no longer a goal for me. So you really want to go to a provider that has that commitment level with you. And then if you're with someone and they don't, then it's just kind of like, I hate to say it, but you're shopping, so go somewhere else, find somewhere else. There's freedom of choice. So make sure that you are in the hands of someone that you trust, first of all, if you do have some type of pre-existing condition. And then, again, like we just talked about, I always encourage people, let's look at what you can do. A lot of those conditions will have like a weight component, especially PCOS has a huge weight component. And so I talk about lifestyle changes with them. What can we do that's within your realm to fix so that way we can increase your chances of becoming pregnant? Small things like getting enough sleep, really helps to increase your fertility.
That's a big one right there. Oh, that's
a lot of people just don't know by depriving themselves of that sleep, they are adding to that cycle because, they they're increasing their level of stress hormones, and they don't eat well. Just all kinds of different things come from that, what else? Eat the foods that you eat. Can we cut down on the carbs a little bit? Maybe get some more protein in your diet, some more vegetables. So, things that people don't necessarily think of when they think of, okay, how do I have a baby?
Mm-hmm.
But, that's just one condition for people maybe that have something like fibroids or endometriosis where there's pain associated with it. I try and encourage patients, get all the information, that you can about it. Mm-hmm. You want to make sure that you are up to date and you're knowledgeable about it. And you want to look at reputable resources. So Dr. Google is not really a doctor all the time. Anyone can go up there and post something up there, and you don't know if it's good information or not.
Right.
So you just want to make sure that you are, have access to these government websites that post about conditions. I know personally for myself, I was, going through some reproductive challenges, mm-hmm. and I didn't know that I had these things going on until I got into my master's program. It was only when I educated myself that I was able to go to my healthcare provider and say, hey, can you test me for this? Because mm-hmm. something's not right. And lo and behold, that's what it was. But had I never empowered myself, I probably would have walked around just as lost, Mm-hmm. So again, I'm not the expert all the time. I'm human just like everyone else. So I tell my patients, hey, if you find something like a research article, let me know, bring it to me, and I'm willing to look into it with you, for you, so we can figure out what's the good treatment, if anyone's doing a trial or something. So I just encourage people to stay up to date on their resources, work on things that are within their control, and then just make sure that they are seeking healthcare providers that are willing to be committed to that process of helping them, get there. So if there's some type of labs to do, and then just having patients follow through. I know our lives are busy, mm-hmm. and it's hard to do things all the time, but, there's a plan in place. Let's try to stick to the plan. If there's follow-up that, needs to be done, then make sure you follow up. Do your part of it. And if we're all working together as a team, every woman that I've seen has been committed to working with me as a partner. Mm-hmm. She's been successful in her process. Awesome. It may have taken some longer than others, but if we keep working together, we're bound to hit the goal.
Right. October is Pregnancy and Infant Loss Awareness Month. Today's episode is brought to you by MyBabyExisted.com, a campaign created by me, Erica M. McAfee, to honor and show that our angel babies did exist. Go to MyBabyExisted.com to download your free meme and then share your pictures. Please post pictures of your ultrasounds, pregnancy bumps, positive pregnancy tests, and babies, and use the hashtag MyBabyExisted to honor your angel babies all month long. We remember our angel babies during the month of October and honor them and their existence in our hearts and minds. So, as you know, this podcast mainly focuses on women who have experienced some loss, whether it's a miscarriage or infant loss or stillbirth. So for those women who are out there that are, dealing with just grief in general, but they're at the place now where, they've, are ready to try again, how do they holistically prepare their bodies to go through that process again?
I do encourage people to start taking prenatal vitamins now. Mm-hmm. You don't have to wait until you have a positive pregnancy test to start. Start now. Even if you're just thinking about getting pregnant, but you don't know when, go ahead and start. So that way, when you do become pregnant, you already have all the essential vitamins and minerals that you need to support a healthy pregnancy. A lot of people start deficient because they never cared about their iron. Mm-hmm. They never cared about their folic acid. They never, thought about magnesium and all this stuff. So if you just go ahead and take these vitamins now once a day and make that into your normal habit, then when you become pregnant, your levels are already normal. So that's one thing that people can do is to start to prepare their bodies. Honestly, I tell people to exercise a lot. Mm-hmm. Exercise is one of those things that allows you, when you are pregnant, to have a healthy pregnancy, mm-hmm. Because we really like to manage your weight while you're pregnant. Mm-hmm. So if that again is a habit going into pregnancy, then it's something that's easier to maintain versus now you feel like you have all this extra weight and now you really don't want to exercise. And the same thing with nutrition. Mm-hmm. If you are wanting to get back into if you decided that you want to have another child and you want to try again, start eating well now, because that supports good tissue structure. That supports women that don't really tear or rip as much, when they do deliver. And that stuff takes time to build. So if you start these habits now, then they'll continue on into the pregnancy. And then I just encourage people to talk about it. Again, find that trusting person that you trust as a healthcare provider. When people come into my office, I always say, like, the GYN office has to be like the beauty salon. Let's keep it real. Keep it 100. Tell me how your relationship is.
Right.
tell me how things are with your man, because all these things add to what we are doing. And if there's if you have a fear about something, let me know so I can try and comfort you during that time or ease you during that time. If you are unsure about when's a good time to start trying, then let me know so I can tell you all these different things. Like, okay, let's let one menstrual cycle pass and then let's start trying again after that. But again, we have to have that trust factor where you're willing to tell me all of that. And sometimes I think when women have had loss and they don't really trust them with that deep, intimate secret, then it's hard to really start that relationship off well and to know what's the best thing to do for them. So I always go back to encouraging having that good relationship with your provider,
right?
And having people that can help just bear that burden with you. I know that it's just a nerve-wracking time in that first trimester when you're waiting to see that heartbeat or you're waiting to get out the first 12 weeks, But if you have people who are a village around you, who are rallying around you, then that just makes it a lot better, makes it a lot easier. If you have a provider that's going to call you and give you those personal details, and that just makes the pregnancy a lot smoother, I think.
So for those women out there who are, they've gone to the same, nurse practitioner, OBGYN, and, they may have not have felt that connection or their trust. Do you recommend that they go shop around for another one until they feel like they understand the losses that they've had, all of their history, so that they can fully trust them through that next pregnancy?
Well, I definitely don't want anyone to lose patience, but at the same time, it's all about customer service. So if you don't feel comfortable with someone, it's just like if you don't like your job. If you go to work every day and you hate going to work, maybe that's not the right place for you. So if you're going to a healthcare place just because, it's the only place in network, but you hate going there, maybe there's someone else in your network that you may benefit from. And everyone, a lot of people have their specialties or their interests listed on their profile.
Right.
So I always read through them, and I make sure that on my profile I put things like PCOS or fertility, just because those are the things I like to work with. So people will know, hey, if you're dealing with those things, come see me.
Yeah.
So I say, hey, it's a large world out here. There's enough to go around. So if you're that dissatisfied, then just find someone who you feel comfortable going to.
Awesome. Are there any other recommendations you have for folks who have lost, like when they actually get pregnant? Do they come in with questions? Do they need any formal counseling? How does that process work normally?
I would say if they've had loss, so let me think. If they've had loss and now they're pregnant, okay. So if you find that you do get pregnant again, I always encourage you to come in early, seek early prenatal care. So that way we can kind of get in front of things and not be behind things. And it doesn't mean that something negative is going to happen, but just so that way we can start care earlier, be monitoring you earlier, and then we can talk about those things that may have happened in previous pregnancies. So we can know if there's something to prevent them. Sometimes we can do some early genetic testing, for example, just to see if there was a genetic component going into that. Sometimes there's different medications that we can discuss to see if that will help to maintain a pregnancy or not. Sometimes we can do an ultrasound a little bit earlier just to make sure that we have good fetal cardiac activity. So good care is, in the beginning, I think is really good. And then just again, I always keep saying go back to that trust factor, but it's so huge, you know. I know a lot of women are really anxious when they come in.
They are.
And I understand why.
It's a lot of anxiety and a lot of fear and all of that comes with it.
It does. As a woman, I understand that. And then I try just to explain to people too, you know, we're a team. So I'm listening to you, but then I want you to also listen to me too. So let me help instruct you when it's the best time to do this. And I know it may seem like it's forever and a day, but trust that I got your best interest at hand. I'm not going to just let something bad happen to you knowingly, you know?
Right.
So we both got to kind of put down some of our, you know, our negative emotions. Say, okay, we're going to work together. I'm going to compromise and you're going to compromise. And we're going to have the goal of having a healthy pregnancy. But early care is really good. And again, I always want to push preconception care with a lot of people, especially if you've had loss in the past. Let's come in and talk about it, how we can help get you pregnant. Maybe there's some lab testing that we need to do before you get pregnant, you know? But we can only have that conversation when you come in before the pregnancy, you know? So just starting early.
Awesome. So how can we empower all of the listeners here to be more healthy before, during, and after pregnancy?
I try to let people know that pregnancy is a part of life. And so you just want to be your healthiest self throughout your entire life. And if you are your healthiest self throughout your entire life, then that's going to carry into your pregnancy. And that's going to carry on after your pregnancy, you know, as well. We see these rock star women probably in the media that are like, wow, she's just bad. You know, like her body is just bad. And she's not back real fast. And I'm not saying we got all the money and the resources they do, but I'm sure, you know, there is some persistence to get back. You know, there are some rock star moms out here in the local community too who just adopt a healthy lifestyle. And it really has to just be a personal commitment. So if you are committed to being your best self for yourself, so you can be the best self for your family and those around you, then you're going to start to practice those good health habits like sleep, stress management, eating well, exercise, you know, life balance and all of that stuff before pregnancy. And then, of course, when you get pregnant, things may change, but you'll work back to get to your normal. You'll find a new normal. And then when the kids come, okay, then you'll find a new normal again because now you have, you know, new children. But you're going to still pass those efforts and those practices on into your children and your family. You're going to prepare those healthy meals for your family. You know, you're going to take your child on those walks, even if you've got them, you know, in the stroller or whatnot, too. So I just always encourage people to be your best self. Yes, be your best self for yourself.
Awesome.
And that will carry you on throughout your entire lifetime, before pregnancy, during pregnancy, after pregnancy. And you will just feel like a new woman, a better you.
Yeah, you just made me think about the other day. I took my son and we walked the Jordan Bridge. Oh my gosh!
Yeah,
that bridge got me.
So many girlfriends. Yes, you know we got their little Bambino strapped on, and we walking.
Yes, ma'am.
And that's just the life we live, and it's awesome. It's amazing, and we may not, don't do it every day, but couple days a week or something, we're out there. So that's awesome.
Yes, I definitely agree. So where can we find you on the World Wide Web and then on social media?
I am on social media as Dr. Shaughanassee Williams on Facebook. You can find me there. You can also go and like my center's page, HealthyHER Center for Women's Care in Virginia Beach. We are also on Facebook as well. You can find me on Instagram as Midwife Speaks, as well as Twitter as Midwife Speaks. On my website, www.midwifespeaks.com, I have a blog, and I just post about different women's health issues, mind, body, soul, stuff that make me laugh for the day, whatever I want to let loose about. You can follow me on any of those websites or social media sites and see where I'm in the community, what we're doing, and I'm just glad to connect with people. So if you see me, just feel free to say hey, and I promise I'm gonna say hey back.
So where can we find you? If anybody who's interested in the Hampton Roads area, where can they find you to book some time with you?
You can always send me an email to Midwife Speaks @gmail.com, and I get all of those directly, my assistant and I, and I would just be glad to direct you to where I am from there.
All right. Sounds good. Well, thank you so much, Dr. Williams, for sharing your wealth of knowledge and letting us know what you do as a midwife, as well as a doctor of nursing practice.
Thank you so much.
Thank you for listening to today's episode. I pray that this show was inspirational and a blessing to you. The show notes and links for today's podcast can be found on ericaandmcafee.com/podcast episodes. Now it's time for you to tell your story. Visit ericaandmcafee.com for more information on how to be a part of the show. You can follow me on social at Erica M. McAfee everywhere on Instagram, Twitter, Facebook. I would love for you to join the community. We need your feedback on the Erica and McAfee podcast. For those of you listening in iTunes, please go to iTunes and rate and review the show. Keep the faith, and I will talk to you next Wednesday.